welcome to the Patient Pulse. This month, we're pleased to welcome Dr. Ziyad Al-Aly to talk about a topic that's becoming increasingly recognized in the medical community, which is long COVID syndrome. Dr. Al-Aly joins us from the VA St. Louis healthcare system, where he is a physician scientist. He directs the Clinical Epidemiology Center and serves as the Chief of Research and Developmental Service. He has broad interests in global health and in the short and long-term effects of COVID-19 on health outcomes. He has published extensively in several major medical journals, and his work is frequently featured in major national and international media outlets, including the New York Times, NPR, BBC, CNN, The Guardian, Bloomberg, The New Yorker, The Atlantic, and several others. So welcome, Dr. Al-Aly. We're so pleased to have you, and please take it away.
Well, thank you for having me. Thank you for the invitation, and really delighted to be with you here today. So what I'm going to talk to you about today is long COVID and provide a little bit of an overview about what we think about long COVID, and sort of communicate a little bit of like the latest research in a patient-friendly way. In terms of disclosures, I have consulted for Gilead, and the opinions expressed in this presentation do not represent the views of the United States Department of Veterans Affairs or the United States government. The things that we're going to cover today is that what led us as a research group to study long COVID. Why are we doing research about long COVID? And then two, I want to try to paint a bit of a picture about what long COVID is. And some people will refer to it as you see in the news and other places as post-acute sequelae of COVID-19. That's the same thing, that's long COVID. And then draw a little bit of a comparative evaluation to compare COVID versus flu, like what happens in people who had the flu in the long term, what happened in people with COVID in the long term. And then try to draw some implications for health systems and communities. So to start with, what led us to study long COVID? At the very beginning of the pandemic, we've resolved as a group, as a research group, to really do our best to identify knowledge gaps that are important to the public, important to patients like you, important to our communities, and try to address them using research. There were a lot of questions at the beginning of the pandemic. No, we did not know a whole lot about COVID, let alone know that something like long COVID existed, or know that COVID could be associated with long-term outcomes of long-term adverse events. So the genesis of our interest in long COVID really emanated from our resolve at the beginning of the pandemic that we wanted to do our part. And some of us were physicians who really went to the front line helping patients. But also some of us are purely researchers and said, like, what do we do as researchers to help our community, to help our collective response to COVID-19? And really, we said we're going to do what we do best, is really identify knowledge gaps, that is questions that are important to people like you, to all of us, and address them using the latest and the most sophisticated research methodologies out there. So at the beginning of the pandemic, we started hearing reports, and this is really in the form of an op-ed piece in the New York Times from Fiona Lowenstein, a patient herself, that she's young and healthy previously. She got COVID-19. Everybody was telling her, oh, you're young and healthy. This is a respiratory virus. You'll get sick for a few days. It'll all go away. And you feel like $1 million in a week or two. And she's like, that's not happening to me. I'm not feeling like $1 million. I'm previously young and healthy, got COVID-19. Weeks after the initial infection, I'm still, having fatigue, weakness, having brain fog. I'm not myself. I haven't regained 100% my health, weeks after the initial infection. So she started ringing the bell and saying, we need to pay attention to this. Not all of us are actually fully recovering, from this coronavirus. And we really need to have a national discussion about what coronavirus recoveries look like. And they don't really look like what they were telling us in the news at that time, that people will get an infection, they'll get over it and everything will be, will be fine. Kudos to them, kudos to Fiona and people like her. Her op-ed piece generated in New York Times, generated a lot of interest from the patient community. So they started, all coalescing around each other. This is, kudos to patient advocacy and patient, like the patient community. And these are the people who really, joined hands and joined forces together to form what we now call the, patient-led research collaborative of long COVID. And it's really a remarkable feat that they all decided to come together, form this movement. They launched their first survey of their membership to really evaluate the range of symptoms, the range of problems, of health problems that people after acute COVID were having. And sure enough, their survey told us for the very, very first time that, a huge number of people with COVID are really not recovering fully after the acute infection. That's even if you follow them, after 30 days, that's the acute phase, supposed to last at most 30 days. After the first 30 days of infection, people were having lingering weakness, lingering fatigue, brain fog, muscle problems, a lot of other manifestations. And kudos to them, they actually coined the term. They came up with the term long COVID. We didn't invent it. This is not an invention of physicians and physician scientists or NIH or the CDC. These are the patients themselves who coined the term, who came up with the term long COVID, and started referring to themselves as long haulers. This is really a remarkable movement by patients themselves to advocate for their interests, to raise awareness of the disease. So these are the people, kudos to them. These are the people who really ignited our interest in long COVID, who really piqued our interest. It's like, okay, we need to do our best to really study this condition, to really understand it better and come up with answers to help patients. So we really, started thinking, how can we, address this question and ask question, what is long COVID? What is it? At that point, we didn't really know that like what it entails, what it really involves. So we did what we do best, when we don't have a lot of information. We did what we call like an unbiased approach to systematically and comprehensively evaluate the post-acute sequelae of COVID-19. What that really means is really wanted to evaluate all the health consequences of having COVID-19 in the long term. That's after you recover from the acute phase, or quote unquote, you get over the acute phase, which is the first 30 days of infection. What are the long-term ramifications of having had COVID-19? What we found was that COVID-19 has a lasting impact. That's not really only in the first 30 days, that even when you follow people in the post-acute phase, after the first 30 days of illness, COVID-19 was associated with increased risk of mental health disorders. We saw people with increased risk of anxiety, depression, sleep problems, substance abuse. We saw increased risk of nervous system disorders. That's increased risk of strokes, headache, memory problems, smell problems. We also saw metabolic manifestations of COVID-19, and that included obesity, diabetes, and high cholesterol. We saw people with gastrointestinal problem or GI problems, including the people with constipation, diarrhea, and acid reflux disease, skin disorders, including hair loss and rash, coagulation disorders, including blood clots, cardiovascular disorders, including acute coronary disease, heart failure, palpitation, kidney problems like acute kidney injury and chronic kidney disease, musculoskeletal problems, including joint pain, muscle weakness, and general problems like malaise and fatigue. We also clearly saw, as I said earlier, cardiovascular problems. People are having myocardial infarction or heart attacks. People are having palpitations and heart rhythm problems. And of course, respiratory conditions, respiratory problems, including cough, shortness of breath, and low blood oxygen. So really, we came to the conclusion from this slide that I can show you here that COVID-19 in the post-acute phase, in the long COVID phase, can affect nearly every organ system. And you can take this to like, if you take one thing from this presentation, like that long COVID can affect nearly every organ system. It can in some people produce brain fog, and in some people can produce new onset diabetes, new onset heart problems, musculoskeletal problems, kidney problems, gastrointestinal problem or GI problems, et cetera, et cetera, et cetera. Long COVID can affect nearly every organ system. And then we said to ourselves, well, We've known for a long time now, for more than 100 years, there's something called seasonal influenza. It's also another respiratory virus. And we were interested in trying to, compare how do people with COVID-19 fare versus or vis-a-vis people with seasonal influenza in the long term. So we did this analysis, and what we found is that the magnitude of risk in people with COVID-19 versus people with seasonal influenza is much, much higher in people with COVID-19. That is, COVID-19 is much, much riskier in terms of its ability to produce long-term consequences than seasonal influenza. Well, we also found that the breadth of organ manifestations is much, much more involved in long COVID or in COVID-19 versus seasonal influenza. So really, this is not like the flu. This is, if you also take another point of, another sort of a, nugget from this talk, this is not like the flu. It's much, much more riskier than the flu in its ability to produce long-term consequences. And two, that the breadth of organ involvement is long COVID is not what you see with the flu. It's absolutely, absolutely not what you see with the flu. So our conclusion here was that it's a different kind of post-viral syndrome. It's a different kind of problem. It's a different kind of virus. It's a different kind of post-viral syndrome. And then we asked the question, well, gee, is this really only happening in people who had really bad disease, really severe disease in the first place? That is, people who, when they got COVID-19, they needed to be hospitalized for it. And then what we found is really that's not really necessarily the case, that the risk was evident even among people who were asymptomatic or who had mild disease, whose disease did not necessitate hospitalization in the first place. And the risk, of course, increased with the severity of infection. Basically, people who needed to be hospitalized or needed to be in the ICU, they certainly had a higher risk. But what I want you also to take from this too is that even in people whose disease was not severe enough to require hospitalization, those people also had elevated risk of long COVID and long COVID manifestations. So what are the sequelae of concerns to us? What concerns us is really coagulation disorder. And I think that this is really of relevance to the patient community that we're talking to today. It turns out that people with COVID-19 have a high risk of blood clots or forming blood clots in the legs, having blood clots travel to the lung, the things that we call deep vein thrombosis and pulmonary embolism, respectively. So this is really very common in the acute phase of COVID, and it's not uncommon in long COVID. Even weeks after the initial infection, people would present with blood clots in the legs or blood clots in the lungs. So coagulation disorders are a thing in long COVID, or the thrombosis or having blood clots is really a thing in long COVID for sure. We also found that people are and we're worried about the mental health consequences of long COVID, and that we see people with increased risk of depression, anxiety, and other mental disorders, including PTSD, and other stress and adjustment disorders. And we think that really demands attention now, so we can hopefully nip it in the bud and address it and treat it now, so to prevent it from ballooning or cascading down to becoming a much, much larger crisis down the road. What we also see in people with COVID-19 who go on to develop some sequelae is that, obviously, pain is one of the cardinal manifestations of long COVID. And some physicians are treating it, or some providers are treating it with opioids. So we see increased risk of opioid use among people with COVID-19 in the post-acute phase of the disease. What that really means to us, it's alarming, and we wanted to make sure that people are aware of this, number one, and then that we are doing everything we can to try to curb overutilization of opioids and try to, again, also nip this in the bud so it doesn't really cascade down to becoming a much, much larger crisis or an opioid use crisis down the road. We also see nervous system and neurocognitive disorders, and you see all over the news, people reporting brain fog and are not able to remember things. And that's certainly one of the cardinal manifestations of long COVID. We also see cardiovascular metabolic disorders, including diabetes and kidney disease. And why those are important and alarming to us, it is because these diseases are chronic conditions that never really go away. Those are manageable diseases one can manage. Those certainly can be managed, but they don't really go away and get cured over time or overnight. So why you should be asking now, like, why would a respiratory virus called SARS-CoV-2 that causes COVID-19 and is supposed to attack the lung, and we know it as a respiratory virus, why would a respiratory virus produce or wreak havoc in so many organ systems outside the lung? Like, why does it cause people to have brain fog? Why does it cause people to have heart problems? Why does it cause people to have diabetes and all the manifestations that I just relate to you? The short answer here, and we have to really be humble about it, we don't really fully understand why a respiratory virus like SARS-CoV-2 produces health consequences outside the lung. One key or leading hypothesis is that SARS-CoV-2 has something called spike protein, and the spike protein seems to attach itself to something called the ACE receptor. And that receptor is present on nearly every cell type in the body. And you can think of it as almost like the key and lock mechanism, where the spike protein is kind of like the key that engages that lock on the surface of the human cell and can open it, then facilitating entry of SARS-CoV-2, of the virus, into the kidney cell or the liver cell or the brain cell or the heart cell, and subsequently resulting in damage in that organ system. So you can think of it really literally as SARS-CoV-2, as luck would have it, has the key to really open so many doors in our bodies and invite itself, so to speak, to the heart, invite itself to the lung, invite itself to the liver, and invite itself to the kidney and to the brain. And then, if this hypothesis was proved to be true, that can actually help us understand and explain why this virus wreaks havoc in so many organ systems outside the lung. And a little bit of other sort of a way to think about it is to think about three potential pathways or mechanisms for long COVID. One is a direct pathway, is that the virus itself, the virus property, as I said, like the spike protein on the surface of the virus, that key that can open doors inside our bodies, or the immune response to it. Those two things could really, present or could really result in, some of the manifestations in long COVID. You can also think about the indirect pathway, and don't really discount that. We think that's actually quite important and profoundly important. The indirect pathway is that the infection with COVID-19 in the context of the pandemic could have led to loss of employment, reduced social contact, isolation, et cetera, grief, stress. That could also produce some of the manifestations that we see here in long COVID. And three, some people could have had diabetes or some of the manifestations for a long time before that, but those were undiagnosed and unrealized until people got COVID-19 and they got checked by the doctor, and the doctor's like, oh, you have diabetes. So keep in mind that those three potential pathways could be working together to produce the broader manifestation that we can now call long COVID. And then one thing to keep in mind here, that long COVID is not rare. And this is another op-ed piece by Fiona Lowenstein saying that a year later, we struggle to be taken seriously. Few think that long COVID can happen to them or that it will affect their post-pandemic life. But long COVID is not a footnote to the pandemic or a curious human interest story. It is America's next big health crisis, and we should prepare for it now. And we cannot agree more. We definitely agree with this. When we account for the toll of the pandemic currently, we account for the toll of hospitalization and death. And that's really only the tip of the iceberg. If you want to see what's beneath the tip of the iceberg, you account for the death and disability that's resulting from long COVID, the early death, the impact on life expectancy, the broad economic implications of this, the people losing their income, people losing their employment, they're not able to rejoin the workforce, et cetera. And all the broad social implications are the families that have been affected, the friendships that have been upended, the relationships out there that have been upended. Every one of us knows somebody either like directly got touched by COVID-19 or long COVID, or knows somebody whose life have been dramatically changed because of long COVID. So do not underestimate the broad, social implications of this and the economic implications of this. So we think that it also has implications for health systems. We think the burden of long COVID is not small, as anywhere between 4 to 10%. Long COVID is not one thing. It's a multifaceted disease that can affect nearly every organ system. It will contribute to a rise in the burden of chronic diseases, including diabetes and kidney disease and heart disease. We think that health systems should react to this by standing up clinics to really help long COVID patients. Many health systems throughout the world are doing this, including several in the United States. We think that post-COVID conditions, the majority of which can be managed by primary care providers, but some of these conditions will require multidisciplinary care, will require specialized clinic to help patients. And what we don't want to see is patients being ping-ponged back and forth between 300 different clinics and really lost in the meantime. That's not really good patient care. That's not really an optimal way of dealing with long COVID. So some people will require multidisciplinary post-COVID care for sure. What are the implications for communities? We think the best way to prevent long COVID is to prevent COVID through vaccination. So if any of you haven't been vaccinated yet, or has a family member that hasn't been vaccinated yet, the advice there is the best way on earth to prevent long COVID is to prevent COVID itself. We also feel that combating misinformation and disinformation is really important. There's a lot of misinformation out there about long COVID. And I think, doing something, what we're doing together today, talking about long COVID and exchanging the right information is key to empowering our communities with the right information, with the right knowledge, so they can have can be, fully informed. And do not underestimate, you guys are a patient community, do not underestimate the power of patient advocacy. I would not be talking about long COVID today. I would not be researching long COVID. I would not even be potentially thinking about long COVID had it not been for the inspiration that we got from patients like you. People who had long COVID themselves at the beginning of the pandemic who said, wait a minute, you guys need to pay attention to this. You need to do research on this. We need to understand it better. It's your job, do it. It's your job to help us. It's your job to do research, do it, and help us understand what long COVID is. Had it not been for their advocacy, for them raising their voice and allowing us to understand that this is really a problem, that we need to understand it and research it, I don't know that I would have paid attention. So the power of patient advocacy, what you guys do is amazing, and continue doing it. It's very, 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 very important. So in summary, long COVID is a multifaceted disease. It can affect nearly every organ system. Now, wherever we looked in the body, there was evidence of damage from long COVID. So it can affect nearly every organ system. So we think the burden of long COVID is evident even among people who are not hospitalized for the disease. People tell you it's only present in people who are really, 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 really very sick. Well, that's true, but it also can be present in people who are not very, very sick in the first place. The burden of long COVID is increased with the severity of infection. We think that governments and health systems must adapt quickly and establish post-COVID care strategies. Last but not least, I really want to acknowledge my team, and I would not be talking to you today and doing everything that we're doing in long COVID had not been, for the encouragement and support from a huge team of people. But really, most importantly, the long haulers who inspired us and continue to inspire us to do this work. And these are patients like you who had long COVID and really whose enthusiasm and energy and advocacy inspired us to do what we do today. So again, thank you very, very, very much for hosting me today. It's an honor to be with you. And again, thank you very, very much for this invitation, for allowing me to give this talk today to you.
And thank you so much. That was such a wonderful overview. I think you really provided all of us with some important food for thought regarding not only the physical and medical consequences of COVID-19, but also the social and the emotional consequences of COVID itself, and then the long COVID that may ensue. So I think we'll probably continue to learn a lot more about this as the pandemic goes on. So I want to thank you so much for bringing forth those very important perspectives. And thank you to our listeners, and stay tuned for new episodes of The Patient Pulse in the coming months.